There's some excellent examples of really good intervention work and really good research, but actually I often read research papers and think they could have done so much more there. When I read articles and research outside of psychology, I can think if they'd have just talked to a health psychologist, that could have been so much better for them, or there's an aspect to improve here. So I think it is about that open, transparent, reaching out, and it takes time. And I think from an academic point of view, it's a workload, and the universities kind of having a more transformative shift towards the engaged scholar aspect of what academia needs to do in this future, in this current and future world of making an impact in healthcare and transforming our new learning and evidence-based into practice. So from an academic point of view, it's allowing the staff to push the boundaries a bit and reach out and work with clinicians, and then vice versa in the NHS or other health services, allowing the staff to have these difficult conversations or admit that they might not understand something or admit that there's room for improvement in a service. That's okay. And then just picking up on what you said before, it is systemic. It is about culture of the environment in which we all work, and unfortunately the politics and the policies and the strategy. But, behavioural science is being pulled more towards public health. So that's starting, it's coming in more, but it is still a little bit of a tick box. We're allowing them in a little bit, but let's keep them at bay as well. From a health psychology perspective, we might think, oh, that's all one-to-one work. But actually, no, health psychology can be community-based and public health focused and change bigger populations and groups of populations. So we need to think smart and clever about how do we expand the current evidence base that we've got to get a bigger reach. All these behaviour change issues, smoking, physical activity, diet, and then the health issues of cancer, heart disease, diabetes, all linked to behaviour. So doing individual one-to-one work with patients is not going to solve these issues, and it's not going to change the world at max. So we do need to think smarter about global population-based behaviour change and how we initiate that across the multiple systemic factors. It is really important aspect. But also for the staff that are working day to day with patients, we need to help them to be more reflective and think about that continuation of improving practice. And I think that's where there's an opportunity for behavioural medicine, health psychology to really enhance healthcare practice overall.